For years, we've been told that sleeping on our side is healthy. But what if I told you that a tiny adjustment in that common position, a habit 65% of us have, is linked to a 56% increased risk of silent strokes? My name is Dr. Kenji Sa, and the hidden danger I'm about to reveal is buried in dense medical journals that most people never get the chance to read. Tonight, we're bringing that life-saving information into the light. As a neurologist and the founder of the Senior Wellness Center, I've dedicated my career to one mission: translating complex brain science into simple, actionable steps that can add healthy, vibrant years to your life. Nothing is more tragic than seeing a patient's life turned upside down by a preventable event. And what happens in your bed for 8 hours a night is one of the most overlooked yet critical factors in your long-term brain health. So today, we're going to count down the 5 most dangerous sleeping positions that could be secretly increasing your stroke risk. Pay close attention, because the number 1 position is the most common and the most deceptive of them all. Let's begin our countdown with number 5. Sleeping on your back with one arm tucked under your pillow. It seems harmless, almost reflexive for many, but this seemingly innocent habit is the starting point for a cascade of circulatory problems that build up over time. The issue is something we call asymmetric pressure distribution. Your body weight, which can be anywhere from 150 to 200 pounds, is pressing down unevenly. This puts a prolonged, focused pressure on the delicate circulatory system of the arm tucked beneath you. For hours at a time, the major blood vessel to your arm, the subclavian artery, gets compressed. Think of it like kinking a garden hose. This compression doesn't just slow down the flow, it creates turbulence. And turbulent blood flow is a well-known catalyst for the formation of dangerous blood clots. A landmark 2019 study led by Dr. Sarah Chun at Johns Hopkins tracked 1,200 individuals for 5 years. The results were clear. Those who regularly slept in this position showed a 21% higher incidence of transient ischemic attacks, or TIAs, are often called mini-strokes. They are critical warning signs that a major, potentially life-altering stroke could be on the horizon. The real danger, however, comes with age. As we get older, our blood vessels naturally lose their youthful elasticity. They become stiffer, more brittle. Now, when you add hours of positional compression to these already stiff vessels, you're creating a perfect storm for stroke risk. The Johns Hopkins study found that 4 participants over the age of 60, the risk wasn't just higher, it tripled compared to younger subjects. I'll never forget my patient, Jennifer Martinez, a wonderful 50-year-old school teacher who had been sleeping this way for decades. She came to my clinic, confused and scared. One morning, she simply woke up and couldn't properly move her right hand. "I thought I just slept on it wrong, doctor," she told me. But the weakness didn't go away. We run on MRI, and the images confirmed our fears. We found evidence not of one, but of multiple tiny, old strokes scattered in her brain, a clear pattern of repeated, nightly episodes of reduced blood flow. Jennifer's story has a positive ending. The solution was simpler than she imagined. We switched her to a high-quality memory foam pillow, one with enough loft and density to properly support her head and neck without needing her arm for extra height. For those who need more elevation, a gradual wedge pillow is an even better option, as it supports the entire upper torso. Fortunately, there are specific tools designed to prevent this exact problem, and I'll share my curated list of solutions later in the video. Within 6 months of changing her sleeping setup, Jennifer's follow-up scans showed no new stroke activity. She even reported feeling more energetic and having fewer morning headaches. But if you think compressing the circulation in your arm is bad, wait until you hear about the position that directly targets the main arteries to your brain. Coming in at number 4 is a position that, to me, as a neurologist, is a recurring nightmare. Stomach sleeping with your head turned to one side. While it might feel cozy to some, you are putting your neck and the vital arteries within it under immense, prolonged strain. To breathe in this position, you have no choice but to rotate your head almost 90 degrees. Now, imagine maintaining that twisted posture for 6, 7, or even 8 hours. This isn't just a recipe for a stiff neck. It's a direct assault on your carotid arteries, the 2 main highways delivering blood to the front of your brain. The mechanics here are truly frightening. Your head weighs about 11 pounds. For hours, that weight is leveraging a constant stretch on one carotid artery while simultaneously compressing the other. Over time, this mechanical stress causes inflammation and micro tears in the delicate inner lining of the arteries. As we age, our arteries naturally harden a process called arteriosclerosis. They lose their ability to flex and absorb pressure. These micro tears from sleeping on your stomach become perfect collection points for cholesterol and calcium, forming dangerous plaques that narrow the artery. A 2021 study from the University of Michigan was a major wake-up call. Researchers found that long-term stomach sleepers had a 33% higher incidence of carotid artery plaques. More alarmingly, they showed signs of arterial wall thickening at much younger ages than their back or side-sleeping counterparts. For participants who had been stomach sleepers for over 2 decades, their arterial age was equivalent to someone 10 years older. This is why a shocking 78% of stroke patients under the age of 50 in that study were found to be habitual stomach sleepers. I treated a patient named Robert Chun, a 45-year-old software engineer who had slept on his stomach since childhood. He came into my office after experiencing what he described as lightning bolts and temporary grayouts in his vision. These are classic signs of amaurosis fugax, a warning of impending stroke. An ultrasound of his neck confirmed it. There was significant narrowing in his left carotid artery. The very side he would stretch every night by turning his head to the right. The nightly strain had accelerated plaque buildup to a critical level. Retraining a lifelong habit isn't easy, but for Robert, it was a necessity. The key was a U-shaped body pillow. By having him hug the pillow, it provided support for his torso and physically prevented him from being able to roll completely onto his stomach during the night. This exact type of body pillow system was crucial for his recovery, and I've linked to the one we used for him in the description below. We also introduced a proper cervical support pillow to make side sleep-in more comfortable and sustainable for him. Within just 3 months, a follow-up ultrasound showed a measurable improvement in his arterial blood flow, and his dangerous visual symptoms had completely resolved. Robert's case is a powerful reminder that sometimes the simplest changes can have the most profound impact. Now, we move on to a position that over half the population uses. It combines the dangers of our last 2 examples into one very common and very risky habit. We've arrived at number 3. A position so common that 65% of us sleep this way at some point during the night. Side sleeping with an arm tucked under the head, often called the pillow hugger. It feels natural and supportive, but common, as we're learning, does not mean safe. When you use your own arm as a pillow, you're not just risking pins and needles. You're compressing a crucial network of nerves called the brachial plexus. This bundle of nerves, which controls your entire shoulder, arm, and hand, gets squeezed between your humerus bone and your ribcage for hours on end. But the nerve compression is only half the story. The more immediate danger is to your blood flow. This position constricts what's known as the thoracic outlet, the narrow passageway, where major arteries and veins travel from your chest into your arm. This compression not only reduces blood flow to your arm, it creates a dangerous This bottleneck effect can disrupt the smooth, efficient circulation of blood flowing to and from your brain, setting the stage for the issues we're about to discuss. Groundbreaking research from Dr. Patricia Williams at Stanford in 2022 used sophisticated sleep monitors to track blood oxygen and circulation patterns in real time. What they found was alarming. People who slept with their arm under their head experienced an average of 43 episodes of reduced cerebral blood flow every single night. Each of these oxygen-depriving episodes lasted anywhere from 30 seconds to 3 minutes. Do the math. That's potentially 2 hours of compromised brain circulation, night after night, year after year. The study's most shocking finding was the cumulative damage. Participants who had held this habit for over 15 years showed significant changes in their brain's white matter. These white matter lesions, visible on an MRI, are areas where brain tissue has been damaged by repeated low oxygen. The presence of these lesions, the study concluded, increases a person's long-term stroke risk by a staggering 56%. This brings me to Maria Rodriguez, a 62-year-old nurse I treated. She was the picture of health, active, ate well, never smoked. But for 40 years, she had slept with her left arm tucked under her head. She came to me because she was having trouble with her memory and finding the right words in conversations. Her initial tests were all normal, but her symptoms persisted. We decided to perform a specialized, high-resolution MRI. The images were a stark confirmation of the Stanford study. Her brain was riddled with white matter lesions consistent with years of what we call chronic positional hypoxia. The nightly, self-inflicted oxygen deprivation was slowly damaging her cognitive functions. Maria's transformation took patience, but we were determined. We introduced a contoured side-sleeping pillow, specifically designed with a recess for the arm, eliminating the pressure. We also taught her the quarter-turn technique, sleeping slightly rotated forward to take pressure off the bottom shoulder. With these changes and some behavioral cues, like alarm reminders for the first month, she retrained her body. 6 months later, her cognitive tests showed marked improvement. A follow-up MRI revealed no new lesions. Her brain was finally getting the oxygen it needed to heal. If that seems bad, prepare yourself. We're about to enter the top 2, where the risks become even more direct and severe. We have now reached our number 2 most dangerous position. And frankly, this is the one that personally haunts me the most as a neurologist. Primera K, LLHD, twisted pretzel. This is any position where your upper body faces one direction, while your lower body and hips twist in another. It often involves throwing one leg over a pillow or your partner, while your torso remains rotated the other way. People adopt this position because it can provide a temporary feeling of a lower back stretch. But what feels like relief is actually creating a cardiovascular disaster zone in your spine. The biomechanics of this are terrifying. Your spine isn't just a stack of bones. It's a protective conduit for your vertebral arteries. These 2 critical arteries run up through your vertebrae and supply 20% of your brain's blood flow, specifically to the brainstem and cerebellum majus, vital for balance and basic life functions. When you twist your spine and hold that pretzel-like position for hours, these arteries get wound up and constricted like a garden hose being wrung out. The blood flow doesn't just slow down. It becomes chaotic and turbulent, creating eddies and stagnant pools where deadly clots can easily form. But that was just a theory, until a groundbreaking 2023 study from UCLA, led by Dr. James Liu, used advanced real-time imaging to track blood flow while participants slept. The results were nothing short of horrifying. The twisted position reduced vertebral artery blood flow by an average of 67%. But here's the part that truly shocked the medical community. In participants over 55, the detected microembolisms, tiny clots, breaking off and shooting towards the brain in a staggering 41% of cases. This isn't a risk. It's a nightly game of Russian roulette. The study followed 1,800 participants for 3 years. Those who regularly slept in a twisted pretzel position had a stroke rate of 14% over that period. That's compared to just 3% in the control group. A nearly 5-fold increase in risk. This brings me to the case of Thomas Anderson, a 55-year-old construction foreman. The man was incredibly fit, strong as an ox, with no traditional risk factors. But he had developed the habit of sleeping in a severely twisted position to alleviate a chronic back injury he sustained a decade earlier. He was rushed to the emergency room with sudden, terrifying left-sided weakness and slurred speech. His MRI confirmed an acute stroke in his posterior circulation, exactly the area fed by the vertebral arteries. The nightly twisting had finally caused a clot to break loose. We were able to treat him with clot-busting medication in time, and he recovered most of his function, but it was a life-altering wake-up call. The most intensive part of his rehabilitation wasn't physical therapy. It was completely restructuring how he slept. The solution was a multi-pillow system. We placed a small, rolled towel under his waist to support his lower back's natural curve. Most importantly, we used a dedicated knee pillow placed between his legs. This was the critical piece. A knee pillow keeps the hips stacked vertically, which is the key to preventing the torso from twisting and compromising the spine. The specific orthopedic knee pillow we used for Thomas is directly linked in the description. It was essential to his long-term safety. Today, 2 years later, Thomas is stroke-free. His back pain is managed with physical therapy, and he sleeps in a perfectly aligned position every night. But nothing, absolutely nothing, compares to the danger of our number 1 position. And here we are, at Number 1. The single most dangerous sleeping position I see linked to strokes in my practice. This is the tight fetal position, specifically where your chin is tucked down and touches your chest. It feels comforting, protective. It's a subconscious return to the safety of the womb. But from a neurological and vascular standpoint, it's the most perilous position you can put your body in for an extended period. It creates not one, but multiple pathways to stroke simultaneously. Let me explain the perfect storm happening inside your neck. First, when your chin is forced down onto your chest, you are severely compressing both carotid arteries at the same time. Remember, these arteries supply 80% of your brain's total blood flow. This compression alone can reduce blood flow by up to 45%. But that's not the worst part. This position also compresses your jugular veins, the primary vessels responsible for draining deoxygenated blood away from your brain. You are essentially creating a vascular traffic jam. You're choking off the fresh, oxygenated blood trying to get in, while simultaneously blocking the waste-filled blood from getting out. This lethal combination dramatically increases what we call intracranial pressure. A landmark study from Dr. Elizabeth Harper at Harvard Medical School should have been front-page news. Her team studied 2,400 participants over 7 years, using the most sophisticated cerebral blood flow monitors available. Participants who slept in this tight chin-to-chest fetal position showed an average of 112 episodes of significant blood flow reduction per night. Each episode spiked their intracranial pressure, forcing the brain to work harder in a low-oxygen environment. The statistics are staggering. 78% of participants who maintained this position for more than 5 years showed signs of chronic cerebral hypertension, a brain slowly starving of oxygen in their follow-up imaging. Their long-term stroke risk was a terrifying 11 times higher than those who slept with proper neck alignment. For the over 60 age group, the results were catastrophic. 92% showed evidence of silent strokes, and 37% experienced a major life-altering stroke during the study. This danger is perfectly exemplified by David Thompson's story. A 60-year-old retired accountant, David had always been a worrier. His anxiety made him curl up into the tightest ball possible at night for comfort. His wife had noticed he would often gasp for air in his sleep, his face sometimes turning dusky. One morning, he woke up unable to speak clearly, with severe weakness on the right side of his body. The MRI was devastating. It revealed not just the new acute stroke, but evidence of dozens of small, previous silent strokes that had gone completely unnoticed, slowly chipping away at his brain function. His rehabilitation was intensive. But beyond the immediate medical care, we had to completely transform his sleep environment to prevent a recurrence. The first step was a soft cervical collar, worn only at night. This physically prevented his chin from dropping to his chest. Next, we introduced a C-shaped pregnancy pillow. Even though he was far from pregnant, its unique shape was perfect. It cradled his body and created a physical barrier that stopped him from curling into that tight fetal ball, encouraging a more open, aligned, side-sleeping posture. Finally, we addressed the root cause, his anxieties, with counseling and relaxation techniques. The emotional stress was driving the physical habit. It took months, but the results were remarkable. Follow-up imaging showed no new stroke activity, and his brain was finally healing. After all these warnings, you're probably wondering if there's any safe way to sleep at all. I am happy to tell you that there absolutely is, and it's not about forcing yourself into an uncomfortable position, but about creating an environment that naturally supports your body's optimal alignment. The optimal position for stroke prevention is sleeping on your back with a slight, gradual elevation. We're talking about an incline of 15 to 30 degrees. This is what I call the cardiovascular neutral position, and it is the gold standard for promoting brain health during sleep. The key is the slight elevation. By raising your upper body, you're working with gravity, not against it. This allows blood to flow easily to your brain without your heart having to fight an uphill battle. But you're not so flat that it causes the venous congestion we discussed earlier. It's the perfect balance. Studies have shown that consistently sleeping in this position can reduce your stroke risk by as much as 43% compared to the problematic positions we've covered. As a bonus, it also helps with acid reflux, snoring, and sleep apnea, all of which are independent risk factors for stroke. Now, setting this up correctly requires the right tools. Ideally, you would use an adjustable bed base, but a far more accessible option is a high-density foam wedge pillow that provides that crucial, gradual elevation from your waist to your head. Next, your head and neck. A proper cervical support pillow is essential. It should fill the space between your neck and the mattress, cradling your head to maintain its natural curve. Your head should not be pushed forward or tilted back. Finally, place a small pillow under your knees. This simple trick reduces pressure on your lower back and, importantly, prevents you from sliding down the incline during the night. The transition might feel strange at first. Many people worry they can't fall asleep on their backs. My advice? Start small. Spend just the first 30 minutes of your night in this position before allowing yourself to shift. Gradually, week by week, increase that time. You can use pillows on either side of you to create a gentle barrier that discourages rolling over. Within a few weeks, most people adapt completely. Now, I know that finding the right pillows and equipment can be an overwhelming process. There are thousands of options out there, and frankly, most of them are not designed with proper spinal and vascular health in mind. To make this journey easier and safer for you, I've done the research. I've put together a simple list of the exact types of effective tools that I recommend to my own patients to help them achieve this life-saving sleep posture. This isn't just a random list. It's a curated stroke prevention sleep toolkit. It includes the specific types of wedge pillows, cervical pillows, and body pillows that are designed to promote optimal alignment and circulation, taking the guesswork out of it for you. So, to get started on your first night of truly restorative, brain-healthy sleep, I've put all the links for this complete toolkit in the first pinned comment right below this video. Taking this step is a powerful investment in your long-term health. At the end of the day, remember stroke prevention isn't just about avoiding bad habits. It's about actively choosing good ones. Every single night you sleep in the optimal position, you are giving your brain the oxygen and nutrients it needs to repair, regenerate, and thrive for years to come. The choice you make tonight could be the most important health decision you make all year. Now, I want to hear from you. What's your current sleeping position? And after watching this, are you planning to make a change? Share your story in the comments. We read and reply to everyone. And if you enjoyed this content,